About injuries at home. Any injuries in elderly people which probably are fractures around the hip or the spine, you cannot ignore or neglect again. There are enough precautions taken in most of the hospitals to handle them. So, for the fear of COVID, don't avoid visiting the hospital. If it requires consultation by a doctor and physical examination, it is better to take them to a hospital and show them with all precautions, because neglecting at the initial stages may land up with more complications and treatments which becomes more complex. The second injury category, where adults getting injured, particularly with their ankles or knees, they may actually end up with significant damage to the joints over a period of time because of ligament injuries. So, if you have persistent pain after an injury, don't neglect it, get it checked and take proper treatment. That should actually prevent further complications in the long term. If you are not willing to visit a hospital, there are a lot of ways to reach out to doctors, particularly online, and you can get it investigated by advice of a doctor. Sharing your investigation reports online is possible, and based on that you can get treated. So, COVID is important. You need to take all precautions for the COVID, but that doesn't mean you should ignore all your other medical conditions. Take care of yourself.